Hi everyone, welcome back to my YouTube channel, and today we are going to talk about testing of vagus nerve. So let's start the topic with introduction. Vagus nerve, that is 10th cranial nerve, is a mixed cranial nerve that arises from medulla and exits the skull through jugular foramen along with 9th cranial nerve and 11th cranial nerve. The word vagus means wandering, that reflects its widespread distribution. It carries motor, sensory, and parasympathetic fibers and play an essential role in voice, swallowing, gag reflex, and autonomic regulation of thoracic and abdominal organs. Because of extensive function, vagus nerve testing is clinically important in patients with voice changes, swallowing difficulties, or loss of reflexes. Functions of vagus nerve: it has motor functions, sensory function, and parasympathetic functions. Motor functions of vagus nerve: it supplies most muscles of pharynx except for stylopharyngeal muscle that is supplied by ninth cranial nerve, that is glossopharyngeal nerve, and it also supplies muscles of larynx except for cricothyroid muscle that is supplied by accessory nerve through external branch of superior laryngeal nerve, and it is also important for swallowing and phonation for voice production. Second function of vagus nerve is sensory function. It gives general sensation from the pharynx, larynx, external ear, and part of external auditory canal. It also gives sensation of taste from epiglottis and posterior pharynx. Then there is parasympathetic function of vagus nerve as autonomic supply to heart, lungs, and gastrointestinal tract up to the left scolex flexure is given by vagus nerve. Methods of testing: first we do is voice quality. We ask The method of it to check it is to ask the patient to speak, count, or say a sentence. If there is normal finding, it will be clear normal voice. In case of abnormal finding, there may be hoarseness, that is unilateral vocal cord paralysis, nasal speech that indicates palatal weakness, and aphonia that indicates bilateral paralysis. In second method of testing we do is to check palatal movement, and the method of checking palatal movement is to ask the patient to say ah while observing the soft palate and uvula. If there is normal finding, it would be palate elevates symmetrically and uvula remains in midline. But in case of abnormal finding, the palate fails to elevate on affected side and uvula will deviate to the normal side, that is away from the lesion. Third method of testing vagus nerve is gag reflex, as motor limb of gag reflex is by vagus nerve. The method of it is to touch the posterior pharyngeal wall or tonsillar region with a cotton depressor or cotton swab. In case of normal finding, there will be contraction of pharyngeal muscle and gagging, but in case of abnormal finding, there will be absent reflex due to vagus nerve damage or lesion that provides motor limb for the gag reflex. We can also do swallowing test for vagus nerve. The method of it is to ask the patient to swallow water and observe for difficulty or choking or nasal regurgitation. In case of normal finding, there will be smooth swallowing, but in case of abnormal finding, there will be dysphagia, that is difficulty swallowing, and it suggests vagus nerve involvement. Uh, Fifth method of testing vagus nerve is cough reflex, that is optional in clinics, and method of it is to ask the patient to cough voluntarily. Normal finding of it will be that there will be strong forceful cough, but in case of abnormal finding there will be weak or absent cough that indicates impaired motor control of laryngeal muscles. Now let's talk about abnormal findings and clinical. If there is dysphonia or hoarseness, that indicates lesions of recurrent laryngeal nerve, that is branch of vagus nerve. In case of nasal regurgitation and dysphagia, it represents palatal weakness due to vagus palsy. In case of deviation of uvula, it indicates that movement is away from the side of the lesion. In case of loss of gag reflex, it indicates vagus nerve lesion. In case of jugular foramen syndrome, that is also called as Werner syndrome, it indicates involvement of 9th, 10th, and 11th cranial nerve that cause combined deficits. In case of bilateral vagus nerve damage, there is life-threatening due to risk of aspiration and cardiac or autonomic disturbances. Clinical significance of vagus nerve testing. Vagus nerve testing is vital in evaluating patients with swallowing difficulties, voice changes, or absent reflexes. It differentiates central causes, that may be stroke and brain stimulation, from peripheral lesion, that may be tumor or surgical injury. Recurrent laryngeal nerve involvement is important in thyroid surgery, lung cancer, and mediastinal metastasis. And because of its parasympathetic role, vagus dysfunction may also contribute to autonomic symptoms. Conclusion of this lecture video. Vagus nerve testing primarily involves assessment of voice, palatal movement, gag reflex, and swallowing ability. Abnormal findings include hoarseness, dysphagia, absent gag reflex, and valvular deviation. As the vagus nerve has critical role in both motor and autonomic functions, its elevation is essential for detecting brain stimulation, jugular foramen syndrome, and surgical injuries. And this was all about vagus nerve testing. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.